manipulations. So if you've seen a chiropractor, osteo, they're able to sort of do these manipulations. And then we have our mobilization. So that's more sort of when we work on the spine or different joints of the body, just trying to get them, to move in the direction, that they normally should move in. Muscle releases. So a lot of active release or soft tissue. So a lot of people, you come in with your, your trap strains or your necks tight, and we sort of work through those muscles that way. And then the modalities. So IFC, ultrasound, TENS, all those types of things are what we call modalities. So just sort of to summarize what passive treatments are, it's when the therapist, your physio, your chiro, when they're doing sort of the treatment for you, it requires a lot of, hands-on stuff. You might just be lying there. You might not be doing a whole ton. And I find that, these are really useful, techniques to use, especially in the acute stage. So, when you're having a flare up or when you're in a lot of pain and say the active stuff might not be available to you right then. But then we get into our active rehab. So strength, stretching, stability, and then our more, sport specific or like your work specific task specific types of exercises. So, it really, if you really want to make, those changes, those long lasting changes, your tissue health, your strength, all of those things, it's going to be that active rehab and that stress to those joints, those muscles, and to really make those changes. When we're doing, more passive treatments, the changes that we're going to, be achieving are just going to be short term. So if we really want those long term changes to happen with your body, which are going to, take you out of pain, which are going to get you back to doing what you want to do, it's really, that active rehab that plays such a big role. So, the question being, is one better than the other? And I don't think that one is. I think that each one definitely, has a role. But you should never just be, just doing passive rehab. You shouldn't, just rely on someone to sort of treat you. You really have to, be accountable. You really have to, take that step and get into that active rehab if you do want to get better.
Yeah, completely agree with that one. I find a lot of patients get into just doing the passive rehab and kind of thinking that that's the end of the treatment. It's so important to make sure that oftentimes if you get an injury to the lower back, I think we were talking earlier today about like hip pain, things like that. It's important that you kind of follow up and kind of do the rest of the treatment. No different than like taking an antibiotic. You wouldn't just take it for half the period of time. You'd want to take it kind of completely. But then you need to kind of stay healthy, getting lots of sleep, kind of doing all those things to stay, keep your immune system up. The same thing goes for musculoskeletal injuries. You need to strengthen that, because if you don't, you're kind of more prone to either re-injury or change or causing an injury to a joint above or below that area. So a lot of times people just kind of neglect the whole active, or as you were saying, Amanda, the chronic type of rehab for pain relief. And people get caught in this cycle just doing consistent passive rehab, which leads to usually just kind of a quick fix and then continued pain down the road. So
yeah. And the thing too is passive rehab is the one that feels good, right? Everyone like it's your feel good stuff, and the active rehab is it actually takes quite a bit of work too. So
yeah, that's key. The work. Yeah. It's nothing comes for free. So you got to put some work in. That's for sure.
Yeah, exactly. All right. So getting started with just breathing, it seems something that's really, really simple, but it's something that, when people are experiencing low back pain, even just, taking those deep breaths can be difficult. A lot of studies have actually just shown that people who have back pain, they just breathe differently. Some people with back pain, they tend to hold more air in, and that could be as like a compensation for, not having the core strength to, to have stability when you're doing a task. And so instead you're just, holding your breath to brace. So the ideal way that we really want to breathe is we really want to expand out, more through our diaphragm, which is down here. We want to come out, and then we also want to come, out this way, and we also want to come out this way, and not be breathing up through our chest. So the first exercise that we're going to do is just to work on some diaphragmatic breathing. So I want you to place one hand on your belly and then one hand on your chest. And so when we breathe in, you want to feel that your hand that's on your belly is the one that's moving out, and just a little bit of motion up through the chest. So you're going to breathe in through your nose, and we're going to breathe out through our mouth. So in through the nose.
And as you're doing this, Amanda, absolutely right. Like if you look at kind of babies and things like that, they actually are the ones that belly breathe. We all belly breathe when we're first born, and then we start getting into using secondary muscles to help us breathe. And it's very shallow breathing. A lot of times if you're sitting at a desk for a long period of time, you'll get shallow breaths, things like that. And what you were talking about of holding kind of air in, not getting good air circulation, if you get a lot of CO2 buildup over a period of time, it can cause a lot of different things. It can manifest in terms of like an anxious type of feeling, changes the pH of your blood. So all those types of things that definitely we don't want. So it's really important, and is actually part of like meditation and things like that, of belly breathing. So super important thing to do outside of even just lower back pain.
Yeah. So then, yeah, once we sort of get the breathing under control, that's when we move into our core exercises. So we have our transverse abdominis, which is our very deep muscle. So not our six-pack abs, sort of in behind that. And it's one of our endurance muscles. So it's really responsible for, everything we do, just, walking, moving around, sitting, those muscles should sort of always be active. And then our rectus abdominis, our obliques, sort of our six-pack muscles, those muscles are good for strength. So when we're lifting something, when we're working out, those types of activities is when we want those muscles working. So again, with, even not with just low back pain, just with a lot of people, we find that those transverse abdominis muscles just aren't working as optimally as they would be. That sort of connection between them and our muscles is just not communicating. So it's just all about retraining the brain, teaching the body how to activate those muscles before we get into, our more intense, core ab exercises. We just want to teach people how to activate their transverse abdominis. So for this one, what you want to do is you want to come onto your back with your knees bent. Usually this is a pretty comfortable position for people. And you want to you have these bony hip bones here. So you want to take your two fingers and you want to come on the inside of them, sort of on this like hard tissue area. And then you want to make sure that your back's going to be nice and flat into the floor. And you're going to try and almost like squeeze your bladder muscles or sort of brace your core as if someone was going to punch you. And you want to feel that sort of push back against your finger. So you're going to now have this sort of hard muscle contracting underneath of your fingers. And then from there, you just want to work on being able to maintain that contraction. So even just holding it for 5 seconds and then relaxing. And then again, so pushing your back into the ground, squeezing those muscles, feeling it get tighter underneath of your fingers. And in the beginning, we just spend a lot of time just teaching people how to do that contraction. And it actually really becomes hard work for people. But, if you've done this in the past, if you're able to do that, no problem. Then we start adding motions with our feet to try and maintain that contraction. So the first one that I like to start off with is, so once you have that contraction, once your core is nice and activated, you're going to try and maintain that contraction as you just lift and sort of march with your feet off the ground. So as soon as you sort of start to feel like it's squishy again under your fingers, you want to just sort of reset, contract those muscles, and then just start to march.
Yeah, because a lot of people will typically, sorry not to cut you off there,
go ahead.
What you're just describing there is just that you're not engaging your hip flexors. So a lot of people will tend to rely on their hip flexor muscles to try and get that movement. Even when they're walking, a lot of people are dependent on those rather than kind of using those lower abdominal muscles. Even if you're doing crunches, things like that, oftentimes you're not actually engaging the lower portion. So this is a huge one to kind of work your way up to developing stronger lower abs, which then translate to much better stability in terms of your lower back and things like that.
Yeah. So sort of just as like a progression, once you are able to, find that contraction, you want to really maintain that contraction as you're doing any core exercises. So our next progression would be sort of our dead bugs. So again, keeping your back nice and flat, engaging those little muscles there, and then we add opposite arm, opposite leg.
This is an awesome exercise, by the way. Dead bug is, and that progression up, if you can't do this, this is a good progression. So do the march first. First learn how to engage, then do kind of the march, then do dead bug, and then potentially kind of what you were
like if you just hold your arms up and then you just work on maintaining that contraction as you lower the leg and keep the arms.
And you're doing, it's opposite arm, opposite leg?
Yeah.
Yep. Okay.
Yeah. And then sort of, once again, these are a little bit more advanced. So if you are in those like sort of acute stages, we'll sort of work up to here, and then just coming onto all fours, again, trying to maintain your spine pretty neutral, and then really engaging those muscles in through here. And then we do the same thing in 4-point kneeling. So opposite arm, opposite leg. What we don't want to see is sort of things start really arching and you sort of losing control. So every time we want to, retuck our pelvis under, engage those core muscles, and then lifting.
And if you're finding you don't have like either a long mirror or a mirror to kind of look at yourself doing this, I tell my patients it's a good idea to even put on your video camera on your cell phone. Just record yourself doing that. You start seeing kind of that bowing action, especially in kind of the lower back, or if you're kind of hyperextending, you're kind of putting things a little too high. Everything should be completely flat in terms of all that. So keep an eye out for that as well.
Yeah. Okay. So now we're going to move on to some mobility stuff. So focusing today on just more spinal mobility. But again, the hips, hip mobility plays such a big role in just our health of our low back and everything else. So we did a webinar a couple weeks ago on hip mobility. So if, you guys can sort of just reach out to Integra and ask if you can have access to that, or send me an email, I can send it to you too. But so today we'll be focusing more on the mobility of the spine itself. So not just focusing on the low back, because we know that if, one area of the spine's not moving, then the area below and above tends to have to compensate. So if we look at our mid back, if that area is really, really stiff, not moving, like it should be, then our low back, has to do more work. And then the same, if the low back isn't moving optimally, then, things stiffen up there, then that's how injury can start to happen. So the first exercise we're going to do for our mid back is going to be some thoracic spine mobility. So you want to come into side lying, and you're going to have your, I have my right arm down on, and then my left hand on top of it. Knees are tucked into my chest. And then you're going to start to open up your hand like a book, follow it with your eyes. And the goal is to try and get the back of your hand all the way onto the mat, onto the ground beside you. But what you want to make sure isn't happening is that your hips aren't rotating. So you really want to try to keep both hips on the ground, and then just have the movement coming from the upper back. So as you breathe in, your hands should be together, and then as you breathe out, it should help you get a little bit more range that way.
Yeah.
And obviously always doing these on both sides. A lot of the time people are more stiff through one direction. So always doing them both sides.
Perfectly fine too. I'll often get patients asking me like, oh, I'm so concerned because I'm hearing like cracks and pops, things like that.
Mm-hmm.
There's definitely joints within the back, within the pelvis that are perfectly fine to move. Actually, that happens quite often. And that kind of clicking or kind of snapping sound, it can be a variety of things, tends to not generally indicate something bad or anything like that. So be cognizant of it, but obviously it does not mean that you're doing anything wrong or you're doing things improperly. So not to be scared of that.
Yeah. And then so getting into the low back. So again, this can be one where if you're experiencing acute pain, a lot of times people don't want to do any type of rotation. People don't want to move their low back. So it gets really, really stiff. And then the more that you do that, the harder movement gets to be. So we sort of get into it more gently. So if you're just experiencing back pain, we might just get the back used to moving by just doing gentle rocks like this. And then once we get into the more advanced stages, what I like to do is you'll cross your left foot over your left ankle over your right knee. Again, and then trying to drop the knees to the ground to the left, and then slowly coming over to the right. So your upper back should be staying on the ground, and then all of the movement should just be coming from the low back and the hips.
Yeah, the key is keeping those shoulders down, which you're doing a good job showing. Yeah, I think we talked about this last time, I think, Amanda, just that if you don't move a joint, and there's a lot of small joints in the lower back, your body doesn't produce the proper, like almost like the oil that's needed, or the synovial fluid to kind of keep those joints nice and lubricated. They're going to lock up. That's going to cause a lot of like bone on bone type of action and movement. And that's going to cause arthritis and all kinds of pain. So yeah, this is a great one too, to kind of continue doing. It makes you feel a lot better too. Those suffering with just kind of a little bit of lower back pain, just these simple movements can usually alleviate a whole lot of stuff and avoid having to go into like medications and things like that. So
yeah. And then we just have a seated cat cow. So I'm sure a lot of people do cat cows in yoga, sort of on all fours. Just doing them in seated allows you to get a little bit more range of motion, and sort of, especially with bending, which a lot of people with low back pain have a hard time with. So just reintroducing people into, those bending motions. So keeping your hands on your thighs, arching all the way through your back as you look up to the ceiling. And then as you roll your spine down, you're gonna start to arch more through the top and then push your back out. And then I want you to slide all the way down so that we're getting full flexion, and then reversing that. So sliding back up, starting to arch through the low back, working up the back, and then ending with the neck. And then again, tucking the chin, rolling from the top of the spine, and then coming down. So depending on sort of where you are at, even just sort of working without adding that bend, you can just sort of do seated cat cows. Again, if you're just, working at your desk, and it's just a way to get the spine moving.
yeah, these are good that you can do. We talk about getting up every like 20 to 30 minutes, which is fine. If you can't do that, if you're on a long call or something like that, you can easily be doing these things while on a call if you can't kind of get up and walk around for some reason. Again, these are just kind of getting that movement throughout the entire spine, helping your body tell your body which way it needs to be moving and where kind of synovial fluid needs to be produced. So pretty easy stuff that you can be doing just at your desk.
And sorry, just to jump in, if anybody has like any questions, feel free to use the chat box or also the question and answer box, and then we can get to that after the presentation as well.
Yeah. So we've just got 2 more stretches and 2 more strengthening exercises to go over. So in terms of our stretching, again, there's a ton of muscles that sort of come up that are tight when dealing with people with low back pain. The 2 I tend to see the most are our hamstrings and our hip flexors. So again, passively, as your therapist, we can, stretch these for you, or we can show you how to sort of passively stretch them. But I like to always make it a little bit more active. So when we're doing our stretching exercises, it's more, adding these contractions in to strengthen the joints around it so that those stretches become more long lasting. Again, if you had come to the hip mobility webinars, we talked a little bit about these pails and rails. So without getting too much into them, they're just these contractions that we do while we're holding stretches that really help make the mobility changes last longer. So how we're going to do that for our hamstrings, you're going to come into this kneeling position from the side, into this kneeling position, and then the hamstring that we're stretching is going to be the one straight out in front of us. So, ideally we want to just hold this position, for anywhere from 30 seconds to 2 minutes, just to get the body to sort of get used to this position. Once we get into our pails contraction, so when I say pails, what you're going to do is you're going to start to push this heel that's in front down into the ground. And we're going to hold that for 10 seconds. And then when I say rails, you're going to try and come down a little bit more and deepen the stretch. So pails is just the contraction of the muscle that we're working on, and then rails is trying to lengthen that even more. All right, so you're going to start to push your heel into the ground, and if you have tight hamstrings, as soon as you start to push, you'll start to already feel the hamstring contract. So you're going to push as hard as you can for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then our rails, you're going to try to come down a little bit closer. So trying to get your chest down towards your thigh, holding that for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then we would just repeat that, 3 times, and obviously doing both sides. So I'll get into our right hip flexor now. So what you want to do is you want to have your right hip down. You want both legs at 90 degrees. And then you're just going to sort of sink into this right hip, sort of try to let your pelvis drop into the ground. And try to maintain, you don't have to have a straight back, but you can have just that natural curve. You don't want to be arching too much, but just the natural curve of your low back. And again, we're just going to hold this for 30 seconds just to sink into the position. And then here, what our Pale's contraction looks like is this knee is going to drive into the ground, and you're going to sort of try to close the space here. So you're almost imagining that you're sliding this heel back and digging this knee in at the same time. So it's sort of this type of motion that we're trying to do. So on Pale, you're going to start to push this knee in, start to push the knee into the ground, start to try and slide this heel back for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then for our rails, you're just going to try and sink this right hip a little bit closer to the ground. And holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So I find because, you know, these stretches aren't just, you know, hold it for 30 seconds. It's something really good. I mean, especially with like virtual rehab right now, that I have a lot of my patients that I'm, you know, coaching a lot of my patients through. And I think it's just a lot easier to you know, to understand, to get through when you have someone sort of helping you out along the way with it. All right, so very lastly, we have some strengthening. You know, I always make sure that my patients have, you know, a good strengthening program, just again, to make those results lasting, make them permanent, and sort of solidify everything that we're doing. So big thing with low back pain is always adding some glute strengthening. So again, our glutes, a lot of people, you know, have tight glutes. Sometimes we think that, you know, because the muscle's tight that it's strong, but really what we're seeing that these things they're tight, they're short, they're weak. And, you know, they really play a big role in stabilizing our pelvis. So we want to make sure that they're strong, that they're able to support our body, you know, make sure everything is balanced out. So the first thing that we start with is just teaching people how to, you know, activate their glutes. You know, a lot of people are doing squats, lunges, you know, tons of what they think are glute exercises, but if you're not properly, you know, activating them, recruiting those muscles, then other muscles start to, you know, take over or work. So we really want to make sure that you're able to really activate them first. So the way we do that, you're going to come lying on your stomach and just focusing on one leg at a time, bending the knee up to 90 degrees, and then not just lifting your leg up like this. You want to really sort of, even if you have to put your hand on it, and really squeeze through that glute and then lift up. And then so once you sort of can get that squeeze and lift, you want to hold it here for 5, 4, 3, 2, 1, and coming back down. And then again, so squeezing, holding it for 5, 4, 3, 2, 1. So with a lot of people, they start to really feel it in their hamstrings. So we might have to sort of, you know, not come up as high, or, you know, not hold it as long, but we really want to make sure that you're feeling it come from your glutes more than your hamstrings. And then our very last one we're going to do.
Sorry, Amanda, just to jump in with the glute activation, what I find a lot of the time is that it actually helps when you're just kind of tapping the glute a little bit, just so you're almost waking up the muscle a little bit as you're doing the exercise sometimes too. We don't realize how little our glutes fire a lot of the time.
Yeah, completely agree. The other thing I was going to say is I find a lot of men have tight hip flexors. So this one's actually a pretty tough one for guys to do. So that one that Amanda was showing earlier, where kind of you're down on one knee and kind of like leaning forward with the hips. That's a really good one to kind of stretch out that hip flexor. You can sometimes start out with some of these more dynamic stretches and then go into some of these kind of more strengthening types of exercises. So this next one is incredibly hard, so or challenging. So she's already doing it with a band. So yeah, anyways, I'll let you go, Amanda.
yeah, I mean, if you guys don't have a band, then even, you know, we work on it without a band. If you want more of a progression, you know, we start to add resistance bands. So again, a lot of times when we ask people to do bridges, they, you know, they'll just sort of come here and just start, you know, lifting. And then again, sometimes we can start really, people say their back hurts when they do it. And really we shouldn't be using our back at all. So I always try to get my patients to make sure you're doing that little pelvic tilt, making sure your back is flat into the ground before you lift your hips up. So that once it's flat in the ground, then from there, you're lifting your hips up. And then we can sort of, that's going to work on our glute max. If we want to get more into the glute med, then we can sort of add some abduction. So that's what the band comes good, just pushing out against the band and then coming back down. And, you know, having to restart every time is okay. Just getting that tuck in so that your back is nice and flat before you come all the way up. And then adding that motion with the band and then coming back down.
Yeah, I definitely find that, especially with the glute exercises, and same thing with this one, not a bad idea, even just again to tap the glutes. Sometimes it's almost a reminder to your brain that it needs to fire too. So that feedback is also just a good prompt for you to even start recognizing that those muscles need to be firing accordingly.
Yeah, and for everybody watching, so when you're saying like there's different gluteal muscles or bum muscles. So when Amanda's talking about the like glute medius and everything, it's just another, it's a smaller one. It's not the maximus, it's not the larger muscle belly. It's one of the smaller ones, but actually it engages a lot and does a lot in terms of our gait or when we're walking, creates a lot of stability. You'll also see people, and that's why we get, Amanda does it, Jocelyn, I'm sure you do it as well, when you get someone to just walk and we kind of watch you walk. We're looking for quite a few different things. Things that I tend to look for is looking at from the back or the front, you kind of look at the person's hips, and the hips will tend to start kind of going back and forth. You get this, the term is like a Trendelenburg type of gait. And what that's causing is there's going to be a lot of movement through the hips, which then causes a lot of micro movement in the lower back. But then also that translates down below as well. That's going to cause possibly some irritation, possibly bursitis, IT band type of inflammation. So a lot of these things that Amanda's kind of going through right now is very important to try and avoid those things down the road. Anybody, well, there's a lot of people starting running again, and if you don't have proper or a stable core or stable base, when you're running, you can run no problem, but in terms of like being able to sustain that or run efficiently without pain and problems down the road, these are all really important things to do on the side. So as much as running and everything is good, we also need to kind of make sure that we're doing the stretching and strengthening of some of those other muscles as well to allow us to kind of sustain that.
And it's really about building stability around sort of the back as well. I find a lot of the times, you know, muscles take over when they shouldn't be. And that's when, you know, again, tying back to what Amanda said, most of the time with muscles that are short and tight versus long and weak, for the ones that are long and weak, as a massage therapist, and it's sort of what I see a lot of times, those are the muscles where we actually feel the pain in, but those aren't the muscles that are actually causing the issue. So
yeah, and we're going to get to questions kind of at the end. We haven't forgot about you guys. We'll just kind of finish up. The way I always describe it too, I try and do visuals with my patients, as they know, is if you think about putting kind of like furniture together and you don't tighten up all of the nuts and bolts to things, the structure is there, but you get a whole lot of movement or small movement within kind of all the joints. And so that's the same idea when we're like deconditioned or those muscles are not all kind of strong and kind of keeping things stable. Lower back pain at the end of the day, usually, yes, there's some structural issues that people can have, but if you have weak kind of structure around that, again, it's going to be a whole lot of movement that we don't want while we're just doing walking or just kind of normal day-to-day things. That causes a whole lot of friction between small joints that causes pain. So at the end of the day, with chronic type of kind of rehab or kind of these types of things, that's going to kind of keep everything in place to avoid all of that.
all right, so I actually think that's the
Oh, we are then.
And
Okay.
yeah, I was like, oh, nope. So we are then.
Yeah,
So we do have a question here. So this individual has mild, moderate lumbar spondylosis and pretty consistent lower back pain and stiffness. Are all of these exercises, stretches good and safe to do, or are there any others?
Okay. So a ton of people come to physio, like chiro, all that, and they tell us that they have spondylosis. Some imaging that they had told them that they have spondylosis. And the thing is a lot of people who have back pain, a lot of people who don't have back pain, imaging might have those findings. So it's, that may not just be the reason why you're having this pain, why you're having this stiffness. We can't always just say that it's because of spondylosis that you are having those issues. What we do see a lot of the times with spondylosis is people have a flexion, bias. So sort of, if you were on our last webinar, we talked about how certain injuries or certain conditions like prefer being, bent over versus being bent back. So a lot of the times we see that, maybe bending over forward might be a more comfortable position for you. So maybe some of the extension exercises that we were doing, might not be the best for you. But again, there's, a ton of things that could be the reason that you have this constant pain and this stiffness. So, some of the exercises we went over definitely, would be helpful and be good. But I think if we could, dive in a little bit deeper, if we could sort of take a look at, how you're moving, what feels good, what's tight, what's weak, I think that would really help us create a better, picture of what's going on with you. And hopefully we could, create a program that would help with some of that pain and stiffness that you're experiencing.
Yeah, I'd say this is probably one of the most common issues that I come across in terms of like a quote unquote diagnosis of something. So people have pain, they usually get imaging, whether it is kind of a X-ray or an MRI, CT, something like that. They then have this diagnosis of, oh, I have spondylosis or spondylolisthesis, or I see another patient here, a panel person asking about degenerative disc disease. These are all terms, though, when a radiologist kind of sees an image, they have to kind of basically call out everything that they see. To what degree do you have that? That's, and kind of what else is occurring, as what Amanda was saying. Just because you have a diagnosis of, let's say, DDD or degenerative disc disease does not correlate with your function or your pain levels or your inability. Some people have numbness tingling. Some people have numbness tingling and pain. So all of these things are linked to kind of the degree of what other things you may be having going on, because degenerative disc disease, well, that can lead to things like foraminal stenosis, which is basically just kind of a narrowing. So if you have kind of the kind of vertebrae above and below, kind of making up the holes on the side where the nerves come out, as you kind of lose that height, the top one is basically coming down the top vertebrae and making that tunnel, so to speak, much more narrow. And then nerves don't like to be touched, and therefore you're going to get basically some irritation. If you add into this things like a bulge disc, our discs are just like a little bit of jelly. That disc, unfortunately, it is not like what everyone thinks of, like just a solid disc. It is just a bunch of goo that's between our the vertebrae. And unfortunately, it wants to go out and be pushed out backwards and to the side. And unfortunately, that's where those nerves want to come out. So in addition to you already having possibly like a narrowed area, that's going to basically protrude into that area as well, making that even smaller and more likely for your nerves to kind of get touched and get inflamed or irritated. With these things, those can all be, sometimes they can go back on their own. It takes weeks, months, sometimes they never go back. So each person has to have their own kind of set of kind of exercises, what can be done, what can't be done. I wish we could just say, oh yeah, this is good for everybody. But that's why it's so important. That's why we stress so much in terms of everyone needs to be assessed, because we're looking, what can you do? What can't you do? I completely agree with what you're saying, Amanda, that yeah, probably what we want to watch is that you're not doing like kind of anything that's over kind of in terms of extension or anything like that, because that's, yeah, potentially going to worsen things. And we potentially you could be worsening kind of your already underlying disease or situation. So we never want to do any of that stuff. So definitely have to get assessed and kind of go from there.
For sure. All right. I think there was another question here, but it is a little bit more specific. So what I'll do is I'll have Amanda reach out to you directly. That way she can give you a little bit more of a tailored sort of answer, because it is a little bit more case specific. So Amanda, I'll send that over to you after the webinar here. But both of you, again, thank you so much for taking the time. And Amanda, thank you as always for going through some awesome mobility and strengthening exercises. She is available for a complimentary discovery call, or you can book her in our virtual services section on our online portal as well. Dr. Gravel is also free to do any phone consults at the moment as well. Yep. To let you know about our upcoming webinars, we have a yoga sequence for our hips, so perfect timing in terms of getting your hips stretched out tomorrow morning with Andrea Lee at 11 a.m. And as well next week, Dr. Dupuis, who is one of our chiropractors on staff, she will be giving us exercises on how to release your mid-back tension at home. So definitely applicable webinars to kind of piggyback off of what Amanda was discussing today. And again, as always, please give us a call or send us an email if you have any questions. You know, Amanda as well as Dr. Gravel are definitely available to answer any of the questions that you may have. And that wraps it up for today's webinar.
Thanks,
all right,
guys.
have a great day.
Thanks, guys.
Bye, guys.
Bye.